Hello, my name is Dr. Yolanda Wimberly, and I'm going to be speaking with you on the topic of a journey of life through the lens of prevention. I am the Chief Health Equity Officer and the Senior Vice President at Grady Health System. I'm also a pediatrician and an adolescent medicine specialist, and I've been practicing adolescent medicine for the past 21 years. I've been at Grady Health System as the Chief Health Equity Officer and Senior Vice President for the past 7 months now. So today what we're going to talk about is just the human life cycle. It's very important for us to understand the different milestones at each part. We'll start off with talking about pre-birth and birth, and then going through infancy, which will be ages 0 through 3, and then early childhood, which are ages 3 through 6, middle childhood, late childhood, adolescence, then coming down to early adulthood, midlife, mature adulthood, late adulthood, and then talking a little bit about death and dying. So if you look at the health domains that we'll be going through with each of those milestone age groups this morning, it will be sensory screenings. We'll talk about developmental and behavioral procedures that you may potentially have to, screening procedures that you may potentially have to participate in, oral health, anticipatory guidance, as well as any key measurements that need to occur. So when we look at the health domains for birth to 11 months, under the measurements, one of the most important things at this point in time is the baby's height, weight, and head circumference. Those are things that at each visit, which typically end up being about every 2 to 3 months that a child is seen, we will pay special attention to the height, weight, and head circumference to ensure that growth and development is occurring as it should be. We'll also look at sensory screening, so look at vision and hearing to ensure that those senses are developing appropriately. Developmental and behavioral health typically comes towards the latter months, like 6 months and above, but looking at, are they rolling over okay? Do they have good head control? Are they making noises as they should? Are they sitting up? Are they starting to track as they should? Those are all things that we look at for developmental and behavioral health. Procedures tend to be mostly just lab tests that we take during this time. So we look a lot at newborn blood, the bilirubin levels, if they have, ensuring they don't have congenital heart defects, that things are going okay. And also, most important, and what most parents and caregivers understand, are immunizations. Those are also key things that happen between birth to 11 months. For oral health, we definitely do perform a risk assessment. Not much is going on at this time. Some children are born with a few teeth, but for the most part, the development of teeth starts about 4 to 5 months, but starting to ensure really anticipatory guidance to ensure that parents are under the understanding of what to look for in that next stage as far as dental health is concerned. Anticipatory guidance, this looks at social emotionally with the child as well as the family and the mother and the father, and then just that community. Now, when we look at the domains for 12 months to 4 years, the same thing when we look for measurements. We're still going to be looking for that height, weight, head circumference, but we're also starting to look at blood pressure and BMI, body mass index as well. The sensory screening remains the same. Developmental and behavioral health, we start to add in there autism spectrum disorder screening. We're starting to really look at that developmental surveillance as well. Usually around an average of around 1 year of age, the kids start to walk. You want to make sure that at least by 15 to 18 months that the kids have started walking. You want to start to look at other things developmentally, words. They may start to speak, just small words at that time. Of course, towards 4 years of age, their vocabulary is larger than that, but really ensuring that the development, that verbal development is occurring. And then you have your psychosocial and behavioral assessments that are occurring with this time frame as well. Procedures, immunizations are still big. Immunizations become big in kids. They stay big in kids until about to 4 years of age. Now, they're not getting as many immunizations as they did when they were 12 months and under, but they're still getting a good amount of immunizations. Screening for anemia, screening for lead. You start to screen for tuberculosis as well as dyslipidemia in the kids. See if they have any lipid disorders. Now, oral health, fluoride and varnish. And so now the kids are starting to actually brush their teeth, whether when you're 12 months to maybe 2 years of age, you're using a different modality, or whether or not you introduce a toothbrush. I'm talking about fluoride varnish to help protect the oral health of the child, as well as supplementation. Anticipatory guidance tends to be the same, social emotionally. Some kids are starting to go to daycare at this age range. Some kids are starting to go to pre-K. And so really always checking about that social, emotional, and family community type of things that are going on to ensure that if resources are available, that that the families know about that. Now, the next big age group is 5 years to 10 years. And so this is going to be your early childhood elementary school development. So this is when the kids are in pre-K or kindergarten, usually going up to about the 4th to 5th grade in elementary school. Height, weight, BMI, and blood pressure are important still in this age point. And then vision and hearing are going to be of paramount importance. I tell my parents always to ensure that you're testing your kids' vision and hearing at least on an annual or every 2-year basis. A lot of times kids are not diagnosed with any type of visual disturbances until they get to school. So it's important to ensure that you're asking your children about, can they see the screen? Are they having any issues with their sight? Oftentimes that's when we first hear of these things occurring. The same thing with hearing as well, is to ensure that you get your hearing tested and the child actually can hear. Developmental behavioral health, in here is just saying your surveillance, psychosocial behavioral assessments at this time. Procedures, immunizations, we're still doing immunizations, but not as much as nearly from 4 and under group. At this point in time, it's probably just ensuring that they have all the immunizations that they were supposed to have. Anemia and lead, definitely there's exposure in the area and exposure in the environment that the child lives in to ensure that you're doing that testing. Tuberculosis as well as dyslipidemia. Oral health, pretty much the same, ensuring that children are brushing their teeth in the morning and the afternoon, and discussing varnishes and any type of supplementation of fluoride that would be needed. Social, emotional, and family community as well from 5 to 10 years of age. You want to ensure that that children have been connected to the resources that they need during this point in time. Then next we have the age group of 11 years to 21. The same height, weight, BMI, and blood pressure, we start to really focus on that a lot more during this time frame. Now, our sensory screening for vision and hearing is still important, especially in our adolescent populations, because we know that they may not necessarily just volunteer the information. And it's going to be important to, especially if your kids are wearing a lot of AirPods, a lot of earplugs, to ensure that you're testing that hearing as well. Developmental behavioral health during this age range is of key importance. I actually do recommend that you offer counseling to all of your kids, if at all possible, during this age group. This is a huge transition in life, a lot of autonomy happening, transitioning from really childhood to adulthood. So it's important that we give kids the support that they need. Immunizations, adolescent immunizations start to kick up a little bit more, not as much still as it was 4 years of age and under. Anemia and lead, we still test for it. Typically, there has to be a reason to test for that, a symptom, and then also tuberculosis as well as dyslipidemia. The same thing for oral health, just ensuring that the teenagers are actually going to the dentist to get checkups with their oral health, and ensuring that that is in order. You are talking about cavity prevention. You're also doing a lot of anticipatory guidance, social, emotionally, and family community. This is the age group where most people are forming most of their habits. If you think about things that you've been doing for years, a lot of them were formulated when you were in your teen and young adult years. And so ensuring that you are definitely checking in with your teenagers. I'll tell parents that, you know, they think that once the kids get 11 or 12 and people are able to stay at home by themselves, that they are actually out of the woods. But I tell parents that in my experience on either side, when you look at infancy and teenage years, as far as the amount of time that parents have to spend with their teenagers, it really does mirror with different needs, of course, but definitely the amount of time that they spend with their kids. I tell parents, you're not out of the woods because they can stay at home by themselves. They still need guidance. They still need you around. They still need your advice. And so just really be mindful of that. Now, for 21 to 44 years of age, okay, we have these domains when we're getting into the cancer screening, right? So cervical cancer screening recommended for 21 to 29, PAP every 3 years, 30 to 65. We got HPV or co-testing every 5 years. Breast cancer, if you're over 40, annual screening if high risk. You're also looking at your vaccines, okay? You want to do flu annually. Make sure your COVID-19 vaccine is up to date. And so it's very important. 21 to 44 is probably the least activity that people will have as far as health screenings if they are relatively healthy people, because of the fact that we only really have one test, the PAP test, and that's going to be in women. That is there for cervical cancer detection. And then the vaccines are just going to be your annual vaccines that we have, but you should be finished with your childhood series of vaccines at this point in time. Now, looking at your health domains for 21 to 44, other screenings, BMI after 35, you want to add diabetes screening if the BMI is over 25. A lot of times what that is people will do a hemoglobin A1C. Chlamydia, gonorrhea screening are for all sexually active persons who are under 24 years of age or those who identify as being high risk or having symptoms. Definitely screening for depression, blood pressure, hepatitis C, HIV. We offer PrEP tests for people, even if they are high risk. And so you want to just be mindful that these are other things that you can do during that 21 to 44-year-old age group. Now going into 45 to 64, we still want to screen for cervical cancer, 30 to 65 years. Every 5 years, you need to get an HPV or co-testing. Breast cancer, 50 to 74 years, every other year. You may start at 40 annually if at risk. Colorectal cancer, 45 to 75 years of age, the annual FIT or colonoscopy test every 10 years. Lung cancer, 50 to 80 years with a 20 pack per year history and currently smoking or quit within the last 15 years. Vaccines for 45 to 64-year-olds will be flu, COVID-19. We have a link here that you can click on to see an updated vaccine schedule. You want to also get BMIs and do diabetes screening if your BMI is over 25. You also have depression, blood pressure, hepatitis C screening, as well as HIV. Now, looking at our health domain, 65 to 84 years of age, we have cancer screening, none if your last PAP was normal in this age range. Breast cancer is recommended up to 74 years of age, colorectal up to 75, and then lung cancer is recommended up to 80 years of age with the 20 pack per year history and currently smoking or quit smoking in the last 15 years. Vaccines, the same as before, flu, COVID-19. And then you also have your Medicare wellness visits during this age, which check for vision, hearing, fall assessment, BMI, and depression. You also have blood pressure, hepatitis C, and ensuring that 65 to 84-year-olds, you have your advanced directives. Over 85 years of age, there's no cancer screening recommended when life expectancy is under 10 years. Vaccines, flu, COVID-19, make them annually and up to date. And then attached below is the CDC vaccine schedule. Other screenings that happen in patients who are 85 and older: Medicare wellness visit, which looks at vision, hearing, fall assessment, BMI, depression, you got blood pressure, and also ensure that people have advanced directives. Now let's look at pregnant women and look at some of the things specifically that we'll talk about them as far as prevention. Cervical cancer every 3 to 5 years, depending on the age. Flu, COVID-19, and see the vaccine schedule is updated in the link. Other screenings during pregnancy, you want to do blood pressure, BMI, depression, postpartum depression, asymptomatic bacteria, diabetes, as well as STDs as needed. Now, this is a busy slide, but I like this slide because it just kind of gives you a graphic overview of the years at the top, the ages, and then also looking at the particular medications down the side. And so hopefully this has been something that has been helpful for you to really think about your health and prevention in your age group milestones. And as you see in healthcare, we have particular things that go within those milestones. And hopefully this information is distilled enough to allow you an opportunity to really just have about 3 to 4 bullet points that you put in each area for consideration during that age milestone. So thank you very much for your time and attention. I hope this is helpful. And this ends my presentation.